A 16-year-old girl presented with a left nostril stenosis of lifelong duration that resulted from a nasal intubation as a premature infant. On examination, moderate to severe stenosis of the left nostril was noted, and the breathing was compromised on that side. The septum and the right nostril were uninvolved. So the problem list is a left nostril stenosis involving the Elie rim and the nasal sill, compromised breathing on the left side, uninvolved right nostril and septum. How would you face the case? Option A, V2I advancement flaps on the columella and the nasal sill. Option B, composite graft and Z-plasty.
The votes are in, and you chose A.
Thank you for allowing me to comment on Face the Case. This is an interesting case from our colleagues in Israel related to a 16-year-old girl with left nares stenosis of a moderate to severe nature. There was no specific scarring involved in this situation, but the stenosis was a lifelong problem related to intubation by the left nares when the patient was a neonate due to prematurity. This is something that the patient has dealt with, as noted in the case report nicely, and needed options with regards to improvement. Our colleagues in Israel offered a very nice solution with regards to a columellar and a nasal sill VY advancement technique using an indwelling flap option, which I think under these circumstances is a very unique and reasonable way to approach this. This area also has numbers of different options that have been described in the literature, including composite flaps combined with or without Z-plasty technique, in addition to other options. Under these circumstances, the technique used was very reasonable and very novel with regards to the ways in which to improve the nostril stenosis. And so, given the option, if you would use the technique presented by the authors versus a composite flap with a Z-plasty, which would you choose? In my estimation, I think the author's option with regards to this reconstruction was excellent and offered an excellent outcome at both 12 and 24 months. And based on the images provided as well as the technique used, is a very viable solution and option for such a situation, particularly when there's no scarring in this area that is involved. So thank you for allowing me to comment on this. I really appreciate being able to do so. And we'll see you again on PRS Global's Open Face the Case for the next opportunity to do so. Take care.